A very pleasant day to you all. Welcome to our clinical biochemistry series, where we get to discuss different types of tests that we can carry out. And today in particular, we are going to be discussing the lipid function test. Joining us today is Dr. Junior Mtavai. Doc, kindly tell us what exactly is the lipid function test?
Thank you, Dr. Mlotwa. So the lipid function test is mainly based on the amount of lipids in the blood. And what are lipids? So lipids are fat molecules that slow down your gastric emptying, and they decrease your intestinal motility, along with acting as a store of energy and also providing fatty acid molecules. They are also a key component in the structure of all your tissues, as they make up the phospholipid bilayer of most cell membranes within the body. So we move on to talking about the way in which your lipids are subdivided into your triglycerides, your high-density lipoproteins, your low-density lipoproteins, and your cholesterol. All these measure up to give your total cholesterol. So this total cholesterol, we shouldn't have high levels of cholesterol in our body, as it may lead to coronary artery disease and also your atherosclerosis. So we need to excrete this cholesterol. And how do we excrete this cholesterol? So on your peripheral artery, we've got deposition of your cholesterol molecules by your low density lipoproteins. Then your high density lipoproteins, which are empty, they come and they collect the cholesterol, and then they proceed to the liver, whereby they go and deposit the cholesterol onto your liver. Then your liver will excrete this cholesterol in bile. And once this cholesterol is present in bile, it is now easily excretable from the body. So then we move on to now talking about the lipid function test itself. And this can be referred to as your lipid panel test or your lipid profile test. This is a group of blood tests that detect abnormalities in the blood lipid levels. And these abnormalities we refer to screening for your primary and secondary hyperlipidemia, and also monitoring the treatment for this primary and secondary hyperlipidemia. We also refer to detecting the risk of your atherosclerosis and your coronary artery disease. And these two have something in common. The fact that we've got cholesterol accumulating in the inner walls of your arteries, and this will thicken and harden, forming plaque, and this plaque is very difficult to remove. And once this plaque is formed, we've got narrowing of the lumen of the arteries, which means that there is less blood, there is less oxygenated blood reaching your heart muscles. And once we've got less oxygenated blood reaching your heart muscles, we've got your heart insufficiently pumping oxygenated blood to the rest of the body. And then we also realize that your lipid function test can also detect the risk of pancreatitis, which is your inflamed pancreas, and also the risk of high blood pressure and also obesity. Thank you very much. Back to you, Dr. Mlotwa.